Start.
Okay, so we just treated Catherine, and it took 4 hands on her, and it took 3 minutes, and we did succeed. I'll show you that these motions were altered, but we tested her in standing, had her look up and down, and now she's comparing that. And so right now, what I predicted was that when we corrected this motion, that she might lose a little bit of extension. Because this segment was stuck in extension, that would actually enhance extension motion, but it would restrict flexion motion. So I predicted that maybe she'll gain some flexion motion. Now go ahead and look down, Catherine, and you had commented a while ago. Just let us know what that feels like.
It's better. I have more range. It's not as tough. It's not as difficult
It's not as difficult to
bend my neck down, to look down.
Okay. My belief is that would be at the end of the motion where it was difficult. Am I correct?
Mm-hmm.
Okay. Or did it feel difficult anywhere else?
No, it just felt difficult.
At the very bottom. Okay. And how about looking up? Is that different in any way?
No, that was always okay.
Okay. And I don't know if, we didn't test rotation. I don't know if that's any different.
It feels good. I don't feel any restriction. So.
Did you generally, or you don't know?
Definitely.
Okay, so rotation is also a little bit better? Okay, can you lay on your back and we'll just show that the segments that were stuck around moving, recall that it was the manubrium, and the manubrium was somewhat forward in relationship to the sternum, and now that's no longer the case. Now, if I have one thumb on the manubrium and I come down to the body of the sternum, it is under the other thumb. Okay, so this has definitely moved back, and the rib has moved back. And these are structures that are designed to move. They are compliant. So it's no miracle that we restored a position, changed her posture somewhat, changed motion there. That's not like, taking a bone and then bending it, it stays bent. I mean, that's not possible, But this kind of thing is very possible. And now when I come underneath, the T1 segment is always prominent. And that one was hypermobile. And now when I spring it, it doesn't move as much. You could see a lot more motion earlier when I was doing this anterior glide. And then when I come down to T2, that now moves. Now when I bounce, I take up the slack, and then when I oscillate it, you can see the movement goes through her body, it accepts it. And I always test the segment below and above just to make sure I'm on the right place and motion is good there. And I did show you a minute ago the rib moves too, so that's nice. Could you stand up and just take a deep breath? Anything with the breath? No, nothing noticeable. Okay, we're done filming. Thank you.